and callers, and not necessarily those of this station, its staff, management, or sponsors. Are you a family caregiver? Are you caregiving for someone who can no longer take care of themselves? Are you overwhelmed? This is Caregiver Solutions Info with Marcia Teele. Marcia will be hosting an hour of true stories and information, tips and updates of the latest research and necessary information in the caregiving field, focusing on you, the family caregiver. An Alzheimer's disease and dementia care expert, Marcia has 15 years of hands-on experience at Arden Courts, a leader in assisted living dementia communities here in the U.S. Marcia covers everything you need to know as a family caregiver, especially if you care for a loved one with Alzheimer's disease or other related dementia or chronic illness. If you have a friend or relative that is also a family caregiver, call them now. They won't want to miss a minute. And let them know they can watch on caregiversolutions.info. And they can listen on WNN 1470 AM in South Florida or nationally on the iHeartRadio app. Now, sit back, relax, and learn from our host, Marcia Teele, as she brings information to you that may just be the caregiving solution you need.
Hi, everyone, and welcome to Caregiver Solutions Info Show. I'm Marcia Teele, your host, and we are in our 6th year of providing you information from experts in the field on all aspects of caregiving, particularly related to Alzheimer's and other dementia. So I'm glad that you tuned in today. According to the Alzheimer's Association's 2019 latest information, there are 5.8 million people in this country living with Alzheimer's disease. And in just 30 years, and it sounds like a long time, but time just flies, in the next 30 years, by 2050, they're estimating that over 14 million people will have been diagnosed with Alzheimer's disease or have it and not even be diagnosed at that time. So do we worry? Should we worry? Are we going to be one of those 14 million people between now and the next 30 years? It's something to think about. And if you're somebody that wants to be proactive and you worry about, am I going to get it? How will I know if I get it? It runs in my family. Maybe I'm a little bit more prone to get it. What do I do about it? So if you're one of those people that want to find out and want to get ahead of the curve, so to speak, before a diagnosis is made, but not quite sure how to go about it because maybe you haven't seen really any major changes, but some little things and feel like, maybe I don't need to see a doctor at this point. It's not that bad. I'll just wait and see what happens. Well, we have good news for you. There is a way to find out ahead of time. And that's what our topic is today. And I'm so excited because joining us from Columbus, Ohio is Dr. Douglas SCHARRE. And he is the, hi there, he's on the screen. Hello, doctor. I'm just introducing you to our Dr. SCHARRE is the director of the Division of Cognitive Neurology at Ohio State University WEXNER Medical Center. And he's a neurologist there, and he's been a neurologist for about 33 years. So welcome to the show, doctor.
I'm not that old, am I?
You know, when you told me you've been in practice since 1987, I did the math, and it actually like 33 years, and that's pretty impressive. Yeah,
well, thank you very much for the invite. Yeah, thank you.
Well, I'm so glad that you could join us. I'm excited to talk to you today so that you can give information to all of the caregivers and other family members who participate in this show and need the information about how we should prepare. We're going to be talking about Alzheimer's dementia, but most importantly, what if it happens to us, and how do we know, and how can we be prepared and get ahead of the curve? And so after all of your years of seeing patients and in your practice, you've developed a new kind of test, and it's called the SAGE test, S-A-G-E. What is the SAGE test, and what does that acronym stand for?
Well, again, thank you for the invitation. It's great to be with you and with your caregivers out there. So, um, a few years ago now, I decided that we needed a test to measure people's cognitive abilities. So, SAGE is really a pen and paper test. Takes about 10 to 15 minutes, and you just answer questions, and it tests different parts of how the brain works: memory and ability to language, name things, and calculations, a whole variety of different items, and you do it on your own. So it's a self-administered test, and it gives you a snapshot of your cognitive skills. So you can get a baseline. Maybe you're still doing pretty well right now, and you say, I have a family history, my mom had it, something of this nature. I want to see how I'm doing now, and maybe you'll get a perfect score or something of that nature. And you can measure over time. So it gives you a snapshot of your cognitive abilities, and if you're beginning to have some slippage, this is the time to get in to see your physician about it.
So you developed this approximately, 10 years ago, I believe you told me. Why did you feel the need that people needed to have a self-administered test? And by the way, SAGE stands for self-administered geroncognitive exam. I like that acronym there, SAGE, because giving sage advice or sage wisdom associated with the brain. But why did you feel that there needed to be a self-administered test that people could do on their own rather than just go to their doctor?
So that's a great question. As a neurologist and specialist in cognitive disorders and dementias, I would get a lot of referrals from family doctors with patients who had cognitive and thinking complaints. And by the time they came to see me, it was clear that their symptoms were starting, maybe 3 or 4 years before. And I was thinking, my gosh, if they would only come in 3 or 4 years earlier, because even with the medications we have right now for neurodegenerative conditions like Alzheimer's, they work better the earlier you start. And so an early diagnosis, one reason to get identified very early. And so these people were coming in far too late, and the primary care doctors were just not picking up on it. The person that usually picks up on it first is going to be the spouse or the person that lives with them, because they see firsthand, they know, well, that's not like them, and they used to be much better with their directions, or they can't find a word, or they're repeating a question, and it's just a change in them. They just weren't like this. I know them, and everyone has different talents, so if a talent has changed in someone, and they're the first ones to tell cognitive issues, but they don't want to tattle on their spouse or their parent and call the doctor immediately and say, she misspoke a word. So you hold off and you wait, and further things get on. And then the physician asks, do you have any memory problems? Sometimes the patient would just say, well, gosh, doc, I'm getting old. I'm 74. Everyone I talk to, they're all complaining about their memory loss. I'm no different than anyone else, so I don't want to. You're very busy, and you have lots of patients to see, and my complaints, which are very slow and sneaky and not causing much trouble, I don't want to bother you with that, so I'm going to downplay it. So I won't mention it too much, or I'll just say it's not a big deal. And of course, as a doctor, if the patient's really not complaining of something, then you're really not going to do more investigation. So if they're not complaining that they have toe arthritis or something, you're probably not going to examine their toe, right? You'll just go on to ask them about how they're doing elsewise. So people would just delay. It's a sneaky process. It doesn't come very fast. And year after year after year would come by until they eventually went to their doctor. And by then the doctor goes, well, gosh, this is, I can tell just by talking to you. I better send you to a neurologist. And by the time they get to see me, they already have mild dementia. For the most part, in which case then your treatments are limited and you're not getting enough supervision. And so it's really important to identify early. So because of all those reasons, I said, we need something better. And the only way I figured to be practical about this was to have and develop a self-administered test. So in other words, this is a cognitive assessment, measures your memory and thinking, that you can do on your own. So it doesn't take the physician's time, the primary care doc's time, or it doesn't take their medical assistant's time or their nurse's time. I mean, they can hand it to you and say, you're over 65, we're just checking to see how you're doing, fill this out, drop it off before you leave, and since it's the 4 pieces of paper, you can do it on a little clipboard, out in the waiting room. You don't even have to be in a regular room. You could do it at home and take it into your physician. It's a free test. And so it was designed to try to help start the conversation. The doctor would look at the test and they go, well, this is sort of surprising. I didn't think you would have problems with these types of tests. Let's talk about it. Let's figure out what the problem is. May not be Alzheimer's. It may be other causes of thinking problems. This test does not diagnose anything. It's not a diagnostic test. It doesn't say whether you will have Alzheimer's or not. It basically just says your thinking is a snapshot of how your thinking is. It's a little bit decreased maybe from what it was. And then it's up to the doctor to try to figure out, okay, is this from your thyroid's too low, or you have sleep apnea, or you're taking too many medications for something or other that could be reduced. Lots of causes for brain thinking problems. Alzheimer's, degenerative conditions are one of those. And if you happen to have that, then they can start you on treatments earlier for those.
Wow, that's amazing. And I don't think a lot of people may know about this or take advantage of it, because I've heard from a lot of caregivers who say, my doctor never asked me how my thinking is. He never really checks for my cognitive health. And this is a great way to kind of initiate that conversation. Also, the fact that people could be in denial when things start to show up or happen, or maybe they're just afraid and they don't want to find out, or they're afraid what they're going to find out. So they postpone going to the doctor, you said sometimes for years, because of either, it's not that bad, it's denial, or they're actually afraid of what they might find. So this is a way to kind of circumvent that and have that conversation early, which is a wonderful thing that you've provided to everyone out there. We're going to take a real quick break, and when we come back, we're going to talk more about the SAGE test with Dr. SCHARRE, and I can't wait. It's going to be great. So stay with us. We'll be right back.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides.
I'm back, and my special guest today is Dr. Douglas SCHARRE, and he is a neurologist and the director of the Division of Cognitive Neurology at Ohio State University's WEXNER Medical Center. Thank you, doctor, for joining us today. We're talking about the SAGE test that you developed several years ago, and it actually stands for Self-Administered Gerontocognitive Exam. So the SAGE test is something that people can do on their own. You can actually download it from a website or Google it, because that's how I found it. I just Googled the SAGE test, and I saw where you can download it. So people can actually download it in the privacy of their own home and do that test. And then the next time they do go to the doctor through their primary, they can present that to them if they have any worries about it. When someone does their test on their own, would it be obvious to them that they're having problems, or is it the kind of test that has to be specifically interpreted with the results by the primary, or would somebody actually kind of have an idea of how they've done on that test?
Well, it's a good question. It depends on how well they're thinking. And since you can download it, number one, as you say, the key thing is take it into your doctor, because they can score it and look at it and base it how it relates to you and based on your other medical conditions. But some of our patients will take the test and think they did perfectly well when it's really obvious that they didn't. So they think that they would know, maybe the date, or they did that math test right, or they thought they did all this pretty well. Others will be able to tell for sure that, gosh, I'm really disappointed. I think I could have done better. This was harder than I thought. So it's a whole range, and it usually depends on what type of brain condition they have. But even if you think you did really well on it, and you did do really well on it, it's important to take it to your doctor anyway. They can scan it into their electronic system or keep tabs on it, and then you have a baseline. And in a year, 2 years, or 4 years, down the road, if you start to have cognitive issues, they can compare. And the doctor can do the testing. There's scoring instructions on the website as well. It doesn't really help the individuals looking at the scoring instructions, because it just says, you did the calculation right, or you didn't do it right, or, it won't necessarily give you the answer. It would just say if it's done correctly, and just explains how to score it. So, but those are there for the doctor. But typically the doctor could just look at how you did, and it's pretty obvious to say, okay, gosh, you did really well. Looks pretty good to me. Or, wow, there's some mistakes here I didn't expect that you would do. You're a college-educated person. You probably would have done better on this. It's surprising to me. So it needs to be interpreted on your baseline. Maybe you've only got through 10th grade of education. So you wouldn't do as well as people that are PhDs or something. Or maybe you're on 3 medications that can affect your thinking, and you have a history of cancer, plus you've had a head trauma, plus you have 3 mini strokes, and the doctor may say, man, this is good for you. It's not like you used to be, but this will be what we expect. I don't need to do more workup. But it's sort of like Alzheimer's is not cancer, but a cancer, for example, if you get it at stage 0 or stage 1, you find it on a chest x-ray, a little mass or something, and you get it out and you find it's cancer. There's a lot more choices, maybe radiation and chemotherapy and surgery. You got lots of choices to treat. Just like Alzheimer's, if you wait till it's metastatic, that is dementia stage, and it's already ravaged your whole brain, the meds don't work really that well. You have less options. It's the same sort of thing. I mean, Alzheimer's is not cancer, but you want to catch it early. And the treatments we have and the new treatments and research we're developing all work better, the earlier you start.
Well, also, when someone takes the test at the doctor and maybe things are a little off, but maybe the doctor is like, wow, you're in pretty good health normally and for your age, and things are off. It could actually be a tool for a doctor to uncover some other things, not necessarily dementia, but some other things that are going on with this person that they may discover. And you want to talk a little bit about that, because you had mentioned to me, like, well, maybe they have a vitamin deficiency that's causing them, to be foggy brained or something like that. And they can actually find what they call a pseudo dementia, right? That where it looks like dementia, but it's not, because it's something else. That could be a really, really good benefit of taking this test.
There's lots of reversible and treatable conditions. And as I said, this test doesn't say you have Alzheimer's or dementia. It just says how your thinking is, sort of a snapshot of that. So sleep apnea, or your thyroid is too low, very treatable, or B12 deficiencies. Maybe you have anemia, you're not getting enough blood to the brain, you don't have good oxygen flow to the brain. You're on medications, and maybe they'll ask you, gosh, what over-the-counter medications? And you start listing, well, I'm on a several allergy ones, and 3 to go to sleep. And those all can affect the brain. All the over-the-counter sleeping pills can affect the brain. Or maybe they'll say, maybe we should cut back on the urinary control medication. That affects your brain thinking. Or maybe you're on a steroid, or you're on medication for chemo, and they may go, gosh, this is sort of like a chemo brain. Maybe I think we can lower that a little bit. Maybe that will mitigate your cognitive issues. So there's many things that physicians can do in light of your health history that this test will be useful for. I mean, doctors sometimes use it before and after a surgery to look at the cognitive effects of that, before and after a chemotherapy agent, to see, okay, this drug is making you a little bit too loopy, let's change to a different one or something. So it can have many potential uses. The claim to fame really is that it's self-administered. It makes it really easy, and it doesn't take administrators or physicians or nurses time to give it to the individual.
And it's free, which is the best part of all, because people can download it, print it, and it's absolutely free. We want to let everybody know how they can get the SAGE test, and they can go to the WEXNER Medical website and get it there, right? Or they can go to braintest.com. Now, there is an electronic version. You may have to pay for that one, but those are a couple ways that people could actually get the actual test for themselves. So I want to thank you for developing this, and you've probably saved many lives and helped so many people by getting them early intervention, so people can go ahead and find out what's wrong. Because I think, like you said, it's better to find out early, see what you can do about it, than to put our heads in the sand and try to ignore it, because things usually just get worse when you ignore them. So I think that's awesome. We want to talk a few minutes too about people that you had mentioned. Sometimes they say, well, I'm forgetting this or that, or, things, I'm not the way I used to be. So I'm just getting old, right? I'm getting older, and that's the way it is. Talk a little bit about normal aging. What's normal and what's not normal as we age when it comes to our brain?
So excellent question, and very important to know about. So obviously we have lots of changes when we age. We see our gray hair and wrinkles, and arthritis gets worse. Just we've overused it for a whole life. We've used our joints. It's also true with the brain. The brain can get damaged, or used, can be affected in many ways over our lifespan. So there's a normal aging process that occurs in the brain. And if you have additional damage to the brain, a head trauma, a few strokes, you're not getting enough oxygen to it, a variety of things can make that worse as well. So these are just normal aging process. The most common thing just with aging by itself, without any other disease process, is that we slow down in our processing speed. So our peak processing speed is like age 20. That's when we're the fastest.
Wow.
And we don't really know that much because we're not experienced, and we're kind of, our frontal lobe hasn't even matured yet. But we're the fastest at about age 20. You see them on their computers or their cell phones. But as we're 40, we're slower than 20, and 60, we're slower than 40, and 80, we're slower than 60. We can have the good judgment. We'll get the right answer. Just give us time, and we'll come up with it. So we have slow processing speed. Don't worry about that. That's normal. Sometimes we'll also be a little more forgetful as we age. How do you tell the difference between that and something you should go see a doctor about? The usual thing is that can you put it in context and recall the event? So, for example, you misplace your keys and you're looking around for them. Where are they? And you're searching, and then you find them on the table. If you can say to yourself, that's right, the phone rang, or I had to go to the bathroom, or someone interrupted me. I know exactly how the keys were there and how they got there. That's a normal aging process. You're cluing. You've encoded it in the past. You see them there. It all comes back. That's normal aging. An Alzheimer or an early abnormal process would be you see your keys and you go, I still don't know how they got there. How did that happen? And you can't put it together. You have you forget a name of a person. All right, that's normal. An actor, actress, book title means nothing. Don't worry about it. This is worse as you age, and some people have more trouble with it than others. So what we worry about that you should see a doctor about in terms of forgetting, it's not in terms of forgetting names, but is in terms of forgetting nouns, objects. So you keep having trouble. It's okay occasionally, but you keep trying to figure out the name of an object. Oh, hand me the thing that I used to flip the pancakes. Oh, you know what it is, and you can't come up with the word spatula, for example, or whatever. You do that too often. That's not normal. Get in to see a doctor. That's not a normal aging process. It's normal aging if you go ahead.
No, I was just going to say, what that happens to a lot of people. I know from my experience, they can't think of a word and they call it a whatchamajigger or a thingamabob or whatever. But if it happens just once or twice, is it still a concern, or does it have to happen frequently?
Well, there has to be a habit to it, right? So everyone can be stressed out. They're not paying attention. They've got other things on their mind, and they can't come up with a word, or they forget what you said. So that's the whole more of an attention thing, right? If you're really stressed out and have 20 things to do, and someone told you, you have to tune in to the Marcia Teele show, this is very important today, or something, and you say, well, what time is that? And you were listening to begin with. So that's an attentional problem. So it will happen to everyone. What is not, for example, what would not be normal would be for you to ask the question again as if you had never asked it before. So you don't ask, I know you told me what time this program was. You remembered, you just weren't paying close attention. You wanted to verify. That's normal. But if you're asking again in the same way, and you're asking as if this is the first time you asked, that is not normal aging. That's repeating. You're not recalling the context from before. You're not cluing well, and everyone knows you're sort of repeating yourself, or you're saying the same story. You just finished telling them that story, and you're repeating it, 10 minutes later, as if you hadn't told it before. That's not normal. You need to get into a doctor for those types of things.
What about the person who is in a situation, and maybe they're with a sibling or a friend about the same age, and years go by and someone says, oh, remember when, and starts talking about detail, where they were, what they did, what was said, and the other person who was right there beside them doesn't remember that at all. How do you explain that?
So that could be worrisome or not. It depends on, some people, we all store memories, and the memories that stick with us, these are the long-term memories. You're remembering a long, distant event, right? So if it's an emotional moment for you, you're storing that memory a lot stronger than someone else, right? So you may have both been in the same place, but for you, this was like something really hit you, was emotional. You just will never forget that. Whereas the other person, maybe it wasn't a big deal, and so they may not remember the details as much as you do because they're buried in your brain, right? On the other, so that could be one thing why you may have differences, and it may just be how you encoded it at the beginning. One person
so it's
more,
not important. Might not be important to them, right? It's like, well, maybe it was more important to one person than it was to another, so they just aren't going to keep that memory because they didn't think it was so important.
Correct. On the other hand, though, if it happens that you can't remember details of the event when someone gives you context, or a movie, you remember that movie and you go, oh, I remember the movie, and you give them some context within a normal thinking person or just normal aging will, come back and say, oh, yes, okay, now I remember, it's all coming back. That would be a normal process. Whereas if you're beginning to have cognitive issues to see a doctor about, you won't still remember, oh, I sort of remember that movie. Yes. Okay, I think so. If it's not coming back to a significant degree, that's a problem and could represent, especially if it's something you just watched or saw, that you should see a doctor about.
Yeah. So it's okay to say, oh, it's on the tip of my tongue. I'll think of it. And usually if you give it some time, you'll retrieve it eventually. I like to go through the alphabet when I'm trying to remember someone's name. And I said, I know it starts with a C, and I'll start, the C with the different vowels afterwards. And eventually, I come up with it. And so I try to make it like a game, because we want to remember, we want to. So as we slow down, like what you're saying, as long as you can retrieve it, I think
Right.
then we're pretty good, because we all are slowing down. Or maybe don't be so stressed out when you're trying to remember, because that's going to affect your ability to retrieve that information too. So all very, very good tips, Doctor.
So
Yeah,
if the
love
name
it.
if his name was Bill or Jack, and you couldn't remember, and they said, "Well, that's Bill," you'd say, "Oh yeah, that's right. That's normal, right?" Someone clues you, and you would know exactly that's the person's name or not. Whereas if they said that's Bill, they go, if you said, "Well, oh, Bill, okay, didn't really ring a bell." That's not a normal aging process.
Really good to know. We're going to take a break, and when we come back, we're going to be talking more with Dr. Douglas SCHARRE and about the memory and the brain. So we'll be right back in just a moment. Stay with us.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help, because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides.
Welcome back to Caregiver Solutions Info Show. I'd like to take this opportunity to thank our national sponsor, Arden Courts Memory Care Communities, and they are located all over the United States in 55 different locations, 10 of them here in Florida. Arden Courts is a leader when it comes to memory care, and they help not only the residents that live in their memory assisted living, but also the caregivers. And because you are listening and you perhaps are a family caregiver, this is a resource for you that Arden Courts would like to provide to you absolutely free, just for the asking. It's a book called The 36-Hour Day, and this is a wonderful resource for family caregivers. Caregivers say their days are not 24 hours. They're more like 36 hours with everything they have to put into those very, very long days. This book is free to you, and all you have to do is email your name and address and phone number and request it. And that email address is delray@arden-courts.com. You see it on the screen there, DELRAY, delray@arden-courts.com. Tell them you heard about the free offer on the Caregiver Solutions Info Show, and they'll be happy to mail a book right to you. So if you don't have this book, or you know somebody that would benefit from this book, go ahead and request it, and they'll be very appreciative of it. So call or email today. If you don't have access to an email, you can call their toll-free number, 888-478-2410. So we're back today. My special guest is Dr. Douglas SCHARRE, and he's a neurologist out of Columbus, Ohio, and he's with the Ohio State University WEXNER Medical Center. And he's also the director of the Division of Cognitive Neurology there. And we're talking about the brain, we're talking about memory. And this is such a wonderful conversation we're having, Doctor, because so many people, worry about that their brain and wonder if it's hereditary. They wonder if they're losing it because they're stressing out, maybe because of COVID-19. And they don't know really what's going on. And I think the SAGE test that we were talking about is a really good way for someone, like you said, to get a baseline. So the SAGE, SAGE test that you want to find out about, you can get it on the website or just Google it. But the wexnermedical.osu.edu website, and go there for more information. So we're talking about more of caregivers now, and what is happening with caregivers. And you do see patients in your office, and you deal with a lot of caregivers over the 33 years you've been practicing. And caregivers sometimes they need as much help, or sometimes more even, than the person that has the dementia, but it's a different kind of help. So I want to talk a little bit about that, because you also educate on something called behavioral modification techniques. What does that mean?
Well, unfortunately, a lot of degenerative conditions like Alzheimer's disease and related conditions, there's maybe 70% or 75% that will develop behaviors that are problematic, that are troublesome for caregivers. And not only do you have the cognitive issues of not understanding what you're saying, or they can't remember what you said, those are a little easier to deal with for caregivers. But when they get into some behaviors, it's maybe a little bit more problematic. So some of the tips, we spend a lot of time in our clinics trying to teach caregivers how to deal with these behaviors. And the first thing I tell them is that you're not going to change the patient behaviors. You have to change your behavior and your approach, and then that will change their behaviors. So it's really caregiver behavior modification techniques, I tell them. And because the patient's going to forget them anyway, so I can speak all I want to them, but they'll say, oh, good idea, thank you, doctor, but they'll forget it in about 5 minutes. So, but the caregiver needs to change their behavior, whether it's in terms of environmental or not. And some of the easiest things are just, understanding the disease process. So, for example, if you have a dementia situation, oftentimes you have more trouble with comprehension. So you're not really following what the person is saying, or especially if it's complex. And so nonverbal communication is really good. If you're calm and you're smiling, even though they're distressed and they think you said something you didn't, or whatever's going through their mind, they're getting disturbed perhaps. Nonverbals are very good. You smile. It's harder to hit someone that's smiling than looks scared or angry, So smiling is a good thing. Open posture, nodding, a thumbs up, good job. You say things so that you make them more at ease, but use your nonverbals, because they can still, if they don't have good vision, but if they still have good vision, they'll see you. They know that maybe they're telling you something. You have no idea what they're saying, and you're very confused. Right. And your facial expressions will look confused, and then they'll get mad that, how come you don't understand me? And they'll get all upset. And you can avoid all that by just, nodding, saying, oh, thank you for that. Very nice. And oftentimes that will get you through, whatever it is. So, so we use techniques like that. Some of the things that we do is assist with the environment. So another favorite things to do is out of sight, out of mind. So they may see something and it may trigger that they want to do something. They see a picture and where's mom or dad, and that you have to tell them that they died and all this stuff. Or they'll see a bowl of candy or something. They want to take too many of them, and you have to keep telling them, no, you should leave that there. If it's something that's bothering them in the environment, get rid of it. And it's going to be helpful. Another really good techniques is, can you help me? Ask for help. So So for example, you want to get your loved one to come down for dinner, or you want to get them to go to the bathroom before they, do have an accident, or you want them to take a bath or something. And if you just start by saying, time for your bath, you haven't had one in 2 days, you're stinky or whatever, and they'll immediately say, I don't need a bath, I just took one, or I don't need to do this, or they're fighting you, and it's like, oh my gosh, they don't understand, they forgot, and they would always take a bath. This is just unlike them. So instead of going through all that, what you do is you say, can you help me? I need your help over here in the bathroom or the kitchen or time to eat or time to go to bed. Can you help me? So that's an elevating thing to them. You're not bossing them. No one likes to be bossed or demanded or told, do this, do that, they of course don't know what to do. That's why you sort of have to boss them. So don't boss them as much and say, can you help me? And that it's an elevating thing. So you must trust them and you must think something of them to ask for their help. So you say, oh, okay, you poor thing, what do you need? I'll go there. And you say, I need help over here. Oh, okay, what is it? It's in the shower here. Something wrong with the knob. What is that? And they get close and you just push them in. No, you don't push them in. But anyway, you've already eliminated, you're already closer there, and then you can, mention other things, or they're already sitting down to the dinner. So you've eliminated a lot of distress for you and for them. So that's sometimes a good technique is, or also one last one, and you can ask me a question, but is instead of bossing them, saying that you're going to do it too, I'm going to the bathroom now. Do you want to go first? So you're doing it. It must be okay. You're not demanding, go to the bathroom. I've already gone. You need to go. We have to go out. We have to leave. You better go before we leave. All these types of things. That's logic. Don't use logic. Just say, I have to do it now. Perhaps you want to go first, or I'm going to take my bath now. Do you want to do yours first? Or, that type of thing. So if you're doing it, it makes it easier for them, and they may decide, I got to take my pills. Here, I got yours out here too. You want to take yours as well or something? And okay, you're doing it. You're not picking on me. Maybe I'll do it without a fight.
Well, those are great techniques, doctor, and I think that they would go far, not just with people that have memory loss and some form of dementia, but I think they would go far with people that don't have cognitive issues, because it's involving people and it's including people. And I think those are great tips that you could use for your spouse, even if he doesn't have dementia. And it would probably smooth some things over and not create some arguments. But caregivers sometimes have trouble fooling their loved one or lying to their loved one. But, what's the pros and cons? Because with your techniques, you're not really doing that. You're involving them in the different ways. So I think that would relieve the caregiver sometimes from feeling like, well, I'm not really lying to him. This is a different way to get him or her to do what I need him to do. And that's so important for caregivers. It really helps in their daily routine and with all the struggles that they go through. So do you teach classes on this? Or are you doing this one-on-one with your caregivers as they bring up their problems in the office?
Well, at a medical center, we do a lot of education of our mission. So yes, I give talks about just this type of thing, plus of course patients that I see, and one of the other things that just popped into mind was just to empathize with them. You don't have to lie necessarily. I remember a lady who was in the appointment with her daughter, and she was telling her daughter someone stole her toenail clippers, right? She was really mad. Her toenail clippers were gone. Someone stole them. And the daughter was going, oh, come on, Mom. Who would steal a pair of used toenail clippers? Your jewelry's still there, the TV there. No one's coming in to steal a pair of used toenail clippers. This doesn't make any sense, right? But of course, that's not reality to them. They think someone stole it. So instead of making them into reality and getting them the truth, you don't have to say the truth. You can just tell them, that's horrible. Someone stole your toenail clippers. Thank you for telling me, Mom. I'm going to get a good lookout. I'll be watching. I appreciate you telling me that. Thank you. Let's go see if we can find it, and it just sort of distracts. You're on their side, they feel good, you can change the subject, you don't have to go to the reality of it, and sometimes that will help diffuse the situation.
Well, those are wonderful techniques, and certainly would be beneficial to anybody caring for someone. So thank you for sharing those. I want to go in a different direction right now and make sure that we do talk about research, because you are also very involved in clinical trial research. Can you tell me a little bit about that, and where is it going, and where do we stand today? Any updates in research that's going to cure Alzheimer's?
Well, we're not where we want to be, but the good news is that the NIH, the National Institutes of Health, and Congress has put, over the last few years, put a little extra money into Alzheimer's research, because that's really what it takes to make breakthroughs. So you get very smart people who are involved in the basic science and translational, changing the basic science mechanisms of how the disease works into possible treatments, and to take it to the clinic to treat humans with it. It just takes lots of funds to support that and to do the studies, and that's what you need for this disease. And for many, many years, cancer, I hate cancer, but cancer's gotten, $10 zillion, and Alzheimer's and dementia research has gotten, a minuscule fraction of that. And so the last few years, people have finally begun to realize, hey, the baby boom population is getting older and we need to do something. And so the more money has gone in, we have a lot more very interesting compounds that are being studied. We have a lot more people then who are interested, because there's funds coming in. They can use their techniques on Alzheimer's as opposed to just cancer. They're getting involved in the field. They're using their smarts to develop new ways and techniques to diagnose and to treat these conditions. And so right now we're doing numerous clinical trials on looking at new medications that are designed to get rid of or prevent the formation of these toxic proteins that build up in the brains of Alzheimer's. These are called plaques and tangles, amyloid and tau proteins. These build up abnormally, and they accumulate over what they usually do, and they're toxic, and they start killing nerve cells, particularly in the memory circuits, and you lose your memory and language and decision-making, et cetera. And so we're looking at medications right now that can get rid of these proteins. So we have several studies going on right now that get rid of amyloid. So, for example, you can get rid of enough amyloid in your brain so that the toxic amyloid you see in a picture or in a spinal fluid test will go down to normal levels. We can get rid of that amyloid in your brain, and we're beginning to see a change if you start on this medication early. And so one of the medications is going to the FDA to see if they can get approval or not in the next few months. You've probably heard about that, aducanumab. It's a medication that gets rid of amyloid. So that's promising. Maybe in the next 9 months or a year, we may have an anti-amyloid treatment. We're looking at anti-tangle or anti-tau treatments. We're looking at synapses. Those are connections between one cell to the next, and making them healthy, and reducing inflammation. Chronic inflammation is very common in Alzheimer's. So there's other measures we have to reduce and block the chronic inflammation, and we'd be able to get rid of those toxic proteins without causing a lot of side effects from all the inflammation in the brain that is not healthy for our brain. And so there's, currently at Ohio State, we have probably 21 active clinical trials looking at treatments, and also looking at, and these are all variety of treatments, and looking at very early cases when you first start having cognitive issues, to even preclinical, that is, people that are genetically at risk. So we're doing studies for people that have genetics of the disease, and we say maybe we can get rid of those toxic proteins, then you won't get the disease. So we're doing tests for those, and then tests for the ones that are a little bit more mild to moderate stage, and we're studying different new medications for behaviors. So we don't have enough great behavior medications that are non-toxic, so we're looking at new medications for that, and we're looking at new biomarkers to see if we can identify people at an early stage. Blood tests for Alzheimer's, we're trying to study for those types of things. So there's a lot of great research going in right now. We don't see the fruits of it yet, But I can tell you there is lots of hope out there that if you're diagnosed with Alzheimer's right now, you're going to have a lot more choices than you did before. And if you have cognitive issues, do not wait. Don't wait till it gets worse. Don't wait year after year. Go in and be tested. And if they say everything's perfect and this was just due to something very treatable, great. We're all happy that you aren't going to develop Alzheimer's. But the longer you wait, the worse it will get. So get evaluated. Ask your doctor. If your doctor's not that interested or sort of pushes you off or is not really as excited as you are, as nervous as you are about it, get another opinion. You can go to someone else that has an interest in that, and they can tell you, no, your doctor was right. It's nothing to worry about. You're fine, or maybe it's just some little more anxiety from COVID, et cetera. And we'll get over this, or we'll keep an eye on you. Or maybe it is something that we can do something about. So get answers. That's the best way to treat this early, is to, or the final thing I'd say is get involved in a clinical trial. We will never get any medications out there without the altruism and this time and efforts of caregivers and patients, because we need the caregiver to tell us how the patient's doing. So it's a team in a clinical trial. They both are joining the clinical trial together. And we will never get any medication out unless people involve themselves in clinical trials, and we can get these medications, find that they're useful, and then get them out to other people.
Wow, that's very exciting news. We actually have a lot of good things on the horizon, and something may be coming out within the next year. In your opinion, in your professional opinion, do you see a world without Alzheimer's in our lifetime?
So I don't know exactly when it will be, but I think Alzheimer's is a very treatable and condition. So will we cure it? Will we ever get rid of it? It's mostly genetic condition. So it runs in families all the time. We don't have genetic markers except for very rare cases that we can tell exactly who's going to get it or not. But there's a lot of family history with it. Doesn't mean if you have it in your family that you will get it, but it's a genetic condition. And until we get, and we're working on gene therapies actually right now. We're working on particular genes to alter them and alter the expression of them. So that's a thing in the future as well. But maybe we can't cure it, but if we can get rid of and keep getting rid of the toxic proteins, we can keep your brain thinking until the end of life, a natural lifespan. We don't usually cure diabetes or high blood pressure or cholesterol. We just treat it. You still have the disease. We're giving you medications. You're taking them lifelong. Keep the blood pressure down, keep the cholesterol down. If we stop the treatments, they would go right back up. You still have the disease, right? So you don't necessarily have to cure it like a cancer, but you can control it and manage it. And instead of a decline of, over 8 years, maybe, you can have a 20-year course or something like that. And then typically if you get it in your 70s or 80s, that will be well past your natural lifespan anyway. So I do believe that we will be able to control the disease.
Well, that's good news. Thank you, Dr. SCHARRE, for being here and sharing your expertise and helping caregivers everywhere. Thank you for your invaluable work, and good luck. Stay safe. And again, thank you so much for sharing today on Caregiver Solutions Info Show. Thank you all for joining in too. Same place, same time next week for another program on Caregiver Solutions Info Show. Tuesdays at 6 p.m. Eastern Time. And call for that book. Email for that book. Get a free book. So, but bye for now. Bye-bye, Doctor. Thanks again. Appreciate you.
Thank you. My pleasure.
Thanks for joining us for this week's Caregiver Solutions with Marcia Teele. Join us next week as Marcia, who has 15 years of Alzheimer's disease and dementia care experience, brings you more needed information to help with the care of your loved one. This show can be seen again on caregiversolutions.info, and questions can be left on the site, which may be used on the program to help others. See you next week for more Caregiver Solutions.